Hello viewers, so today we are here to discuss whether we can prevent diseases and whether one can avoid visits to doctors and hospitals, because we all know and we accept that prevention is better than cure. So over the interactions which I had with various patients in the past 30 years, I have come to realize that there are some 10 basic things if people can take care and look after, most of the serious diseases and many other chronic diseases also can be prevented to a great extent. So let us look at those 10 things. What are those 10 things what one can do to prevent diseases? So number 1 is good sleep. So sleep, nowadays many people sleep less because the working hours have extended, people have longer commute times, but one must ensure 7 to 9 hours of sleep. And studies have shown that people who sleep less than 6 hours or more than 9 hours, they have higher risk of heart diseases, strokes, diabetes, cancer, you name a disease, those things are more with improper sleep. The second thing is healthy food. When we say healthy food, it means avoiding the junk food, anything that has sugar or sweets or high carbohydrates, increasing the protein intake, and then also focusing on foods that are rich in vitamins and minerals, that is fresh fruits, vegetables. So we need 4 to 5 servings of these fresh fruits and vegetables on a daily basis. Also incorporate a small amount, say 30 grams of various nuts or dry fruits, what we call them. So that means they are all healthy food. And then ultra processed food should be avoided. All the packaged foods which have a very long shelf life, which means they have some kind of preservatives mixed in that, they make the food unhealthy. The third thing is exercise. We all know it, but many people don't do exercise. 40 minutes of exercise, whether it is walking, brisk walking, running, jogging, cycling, swimming, yoga, whatever you want, you should do it. So we should be a combination of aerobics with some kind of muscle strengthening or stretching exercise also, about 3 to 4 times in a week. Exercise goes a long way in preventing many diseases. And then the fourth is stress. Almost everyone who I meet today, they have some kind of stress, whether it's a job related stress or family stress or emotional stress or financial stress. So we have to do everything possible to minimize the stress, and stress free life will also lead to lesser number of diseases. And then there are two habits which are also called sin habits. Unfortunately, they are common in our country. They are smoking and alcohol. Smoking, everyone accepts it is dangerous, it is bad, it kills, but still we have so many smokers among men and women. There is no benefit, so smoking should be stopped. Alcohol, many people have this misconception that it is good for the heart, but none of the cardiology recommendations say that people who don't drink should start drinking. If it was really good for the heart, they would have said that. So alcohol, any amount is not good for us, not good for any organ. It causes liver disease, heart disease, brain disease, you name it. Almost all the problems, peripheral neuropathy, many people get burning and tingling of the feet. So both these sin habits should be avoided, and those who are already doing it, they should try and stop it as early as possible. Then there are 4 things we need to keep in mind to keep them normal. One is the blood pressure, keep it below 120/80. And then if somebody is hypertensive, they should take medicines and keep the BP normal. Next is the sugar. So sugar also should be kept normal. If somebody is a diabetic, they should follow diet control, exercise, and if required medications, and keep the HbA1c as low as possible, preferably below 5.7. But HbA1c below 5 is even better. So lower there is no problem. Only high HbA1c should be brought down to as low as possible. The next is the cholesterol. So high cholesterol, high triglycerides, low HDL, low LDL cholesterol, they are all risk factors for heart diseases and brain strokes. So they should be kept to normal by diet, exercise, and if required, then with the help of statins. And finally, the weight, body weight should be kept normal, in that the fat percentage should be reduced. There are parameters we can look at. One is body mass index, so keeping below 25 or as close to 20 as possible. And then also we can look at waist circumference, or something called as waist height ratio. So by these parameters one can keep the weight under control by again diet control, exercise, and good sleep. So these are the 10 things which people can take care to reduce the risk of diseases to avoid meeting doctors and avoid visits to hospitals. So just to summarize, one is regular sleep, then exercise, healthy food, and then avoiding stress, avoid smoking, avoid alcohol, keep BP normal, sugar normal, cholesterol normal, and then weight normal. So I hope this was helpful for you. Please like this video, post your comments, and subscribe to this channel to watch similar videos in the future. Thank you.